Hello, I'm Dr. Sarah Williams, speaking to you from here in the UK. If you're over 60, there's a silent change happening in your body right now that this change isn't about pain at first, and it isn't just getting older. It begins quite the blood vessels of your legs. As a doctor, I see many patients treating tired, cold, or heavy legs as minor problems, when in reality, they are urgent. Today, I want to show you how simple daily choices, including what you drink, can support healthier blood flow and help.
At this very moment, as you're watching, millions of adults over the age of 60 are quietly dealing with a problem that most doctors rarely discuss during short appointments: reduced blood flow in the legs. This is not simply a normal part of aging. It is a genuine medical issue that often begins years before noticeable pain appears. Research from Harvard shows that by age 65, circulation to the lower limbs can decrease by nearly 30%. Once this decline starts, leg strength begins to fade, balance becomes less stable, and the risk of swelling and blood clots rises sharply. After more than 3 decades of working closely with seniors, one reality has become very clear to me. Most medications prescribed for circulation mainly address symptoms rather than the underlying cause. However, when blood flow is improved naturally, especially in the evening, remarkable changes can occur. Arteries begin to relax, nitric oxide levels increase, oxygen delivery to muscles improves, and legs often start to feel warmer, lighter, and stronger again. Recent findings from European vascular clinics reveal something earlier generations were rarely told. What you drink in the final 2 hours before sleep can significantly influence how your blood circulates overnight. When nighttime circulation improves, many seniors wake up with better leg strength and mobility than they have experienced in years. That is why today's video matters. In this presentation, we will share the top 5 drinks that rapidly improve blood flow in the legs. Each one is supported by scientific research and ranked from least powerful to most effective. Be sure to stay until the end, because the #1 drink has been shown in clinical studies to greatly increase nitric oxide and restore artery flexibility overnight, with results that surprised even leading researchers. All reference materials used are linked below. Before we begin, let me ask you this: how old are you, and do your legs ever feel heavy, cold, or numb at night? Share your experience in the comments. We read and respond to every comment as helpfully as possible. Now, let's get started. The drink at number 5 is something many seniors already know about, but often don't use correctly, despite how quickly it can improve circulation. Number 5 is ginger tea. This is a drink that has been used for thousands of years in traditional medicine and is now gaining strong scientific support. Ginger tea may sound like a simple home remedy, but the way it enhances leg circulation is genuinely impressive. When you drink ginger tea, you introduce gingerol into your bloodstream. Gingerol is the compound responsible for ginger's spicy flavor, and it functions as a natural blood thinner and vasodilator. A vasodilator helps relax and widen blood vessels, allowing blood to move more easily. Imagine your leg arteries like garden hoses. Over time, plaque and mineral buildup narrow and stiffen them. Ginger helps soften and gently widen these vessels, improving flow. A study in the Journal of Cardiovascular Pharmacology found that ginger compounds improve circulation by inhibiting thromboxane, an enzyme that causes blood vessels to constrict and platelets to clump. When thromboxane activity is reduced, blood flows more smoothly, easing the heavy, tired feeling in the legs. Ginger also plays an important role in reducing inflammation, which is especially relevant for people over 60. Chronic inflammation damages artery linings and reduces flexibility. Research from the University of Miami showed that regular ginger intake lowered inflammatory markers by up to 30% in older adults. For best results, use fresh ginger root rather than powder. Slice a 1-inch piece into thin pieces, bring 2 cups of water to a boil, reduce the heat, and simmer the ginger for 10 to 15 minutes. This longer steeping time releases more beneficial compounds. After straining, add a squeeze of fresh lemon juice, which helps improve absorption. Drink 1 cup in the morning and 1 in the evening, ideally about 30 minutes before meals. Some people notice even better results when drinking ginger tea before walking or light exercise. If you are taking blood-thinning medications such as warfarin, consult your doctor first. Many people report warmer feet and lighter legs within a week of daily use. Now let's move on to a drink that provides an even stronger circulation boost. Number 4 is green tea, widely known as one of the healthiest beverages in the world. When it comes to leg circulation, the evidence supporting green tea is very strong. Its benefits come mainly from antioxidants called catechins, especially EGCG. A major study from Boston University found that daily green tea consumption improved flow-mediated dilation by about 30%. This measurement reflects how well blood vessels expand in response to increased blood flow, and better results directly translate to improved circulation in the legs. Here's why this matters. The inner lining of blood vessels, known as the endothelium, produces nitric oxide, which signals vessels to relax. As we age, this process becomes less efficient. Catechins in green tea stimulate nitric oxide production, helping restore the vessel's ability to widen properly. Green tea also helps prevent LDL cholesterol from oxidizing. Oxidized LDL sticks to artery walls and forms plaque that restricts blood flow. By limiting this process, green tea helps keep leg arteries clear and flexible. A long-term Japanese study following more than 40,000 adults found that those who drank 5 or more cups daily had a significantly lower risk of cardiovascular death. To prepare green tea correctly, avoid boiling water. Let water cool to about 160 to 170 degrees before steeping for 3 to 4 minutes. Oversteeping releases tannins that reduce absorption. Aim for 3 to 4 cups spread throughout the day, preferably mid-morning or early afternoon. Avoid drinking it with meals if iron absorption is a concern. With green tea covered, let's move on to a drink that works through a different but equally effective pathway. Number 3 is hibiscus tea, one of the most effective natural circulation enhancers available. Made from dried hibiscus petals, this deep red tea has been used for centuries across Africa, the Middle East, and Central America. A clinical trial published in the Journal of Nutrition found that drinking 3 cups of hibiscus tea daily reduced systolic blood pressure nearly as effectively as a common prescription medication. Lower blood pressure reduces strain on leg arteries and improves long-term circulation. Hibiscus contains anthocyanins, the compounds responsible for its rich color. These compounds inhibit angiotensin-converting enzyme, which normally causes blood vessels to constrict. By naturally blocking this enzyme, hibiscus helps keep vessels relaxed and open. Hibiscus also improves blood viscosity. Thicker blood moves more slowly and stresses the circulatory system. The Journal of Alternative and Complementary Medicine showed that hibiscus tea reduced blood thickness, allowing better flow through small vessels in the legs and feet. Many people notice warmer, less swollen feet as a result. To prepare hibiscus tea, use 1.5 to 2 teaspoons of dried flowers per cup of boiling water. Steep for at least 5 minutes, or up to 15 for stronger benefits. The tea is tart, so adding raw honey or lime is common. For best results, drink 3 cups daily with meals. If you take blood pressure medication, start slowly and monitor readings. Women with hormone-sensitive conditions should consult a doctor first. Number 2 is pomegranate juice, often called a superfruit, and for good reason. Pomegranate contains extremely high levels of antioxidants, even more than blueberries or red wine. Its standout compound, punicalagin, has powerful effects on blood vessels. A long-term study published in Clinical Nutrition followed patients with narrowed arteries for 3 years. Those who drank pomegranate juice daily showed a 30% improvement in blood flow, while the placebo group worsened. Even more impressive, plaque buildup was partially reversed. Pomegranate antioxidants neutralize free radicals and increase nitric oxide production. Research from Rambam Medical Center found nitric oxide levels rose by about 50% after just 2 weeks. This leads to wider, more flexible arteries and better circulation to the lower legs. Pomegranate also reduces platelet stickiness, helping prevent small clots that restrict flow in narrow vessels. Choose 100% pure juice with no added sugars. An 8-ounce serving daily is standard, preferably with a meal containing healthy fats to improve absorption. If blood sugar is a concern, limit intake to 4 ounces and monitor levels carefully. Number 1 is beetroot juice, the most powerful circulation doctor on this list. While often overlooked, beetroot is one of the most significant nutritional discoveries for cardiovascular health in recent decades. Beetroot is rich in dietary nitrates, which the body efficiently converts into nitric oxide. This leads to rapid and significant blood vessel dilation. A study in hypertension showed that 1 cup of beetroot juice lowered blood pressure by an average of 10 points within 3 hours and increased muscle blood flow by up to 20%. Researchers at the University of Exeter found beetroot juice matched or exceeded the effects of some prescription circulation medications without side effects. Beetroot also contains betalains, antioxidants that reduce inflammation and protect vessel walls. Regular use improves arterial flexibility, which naturally declines with age. You can buy pure beetroot juice or make your own using fresh beets. Drink about 8 ounces daily, either in the morning on an empty stomach or 2 to 3 hours before activity. Results improve over 2 to 4 weeks of consistent use. Beetroot juice may temporarily turn urine or stool red, which is harmless. Those prone to kidney stones should consult a doctor due to oxalate content. As with any dietary change, moderation and consistency are key. These 5 drinks can meaningfully improve leg circulation and overall comfort, from ginger tea's gentle warming effect to beetroot juice's powerful nitric oxide boost. Each works through a different mechanism. Used together throughout the day, they can provide even greater benefits. Your legs may have struggled with reduced circulation for years, and they deserve this level of care. If you found this video helpful, please subscribe and enable notifications for more research-backed health guidance. We publish new videos every week to help adults over 60 live healthier, more active lives. Thank you for watching.